Hi, everybody, and welcome to part two of our Framing for Health Equity series. So today we have Jessica Moyer from the Frameworks Institute to walk us through putting what we know into practice. So just for a few housekeeping items, this presentation is being recorded. It will be posted on Socius at oralhealth.network after we receive the recording, after it's processed. Currently, everybody is muted, but at the end, or actually throughout the presentation, if you want to unmute yourself to ask a question, you can do so by clicking on the microphone icon on the BlueJeans window, or if you're on the phone, press *4. You can also type into the chat box that's on your right-hand side in the BlueJeans window. So we'll be asking Jessica some questions as we go, so feel free to do that, either ask them ask away or go ahead in the chat box and I'll read them out for you. So great. Thanks so much, Jessica, for being with us.
Thanks for having me, and hi to everyone. I am excited to get to meet some of you. I've heard lots of great things about you from April Callan, who I work with here at Frameworks. So I'm excited to be doing this part two of your webinar series. And I guess I'll start with our agenda, the plan for what we're going to cover in the next hour. I'm going to pick up from where April left off with part one of this webinar series, and just do a really quick review, and we'll kind of build from there. And then the focus of today will be to give you practice time. We're going to walk through 5 different recommendations that stem from our research on framing oral health. So I'll kind of introduce the recommendation to you, and then I've built into the agenda some practice time for you to work with the recommendations and see how it feels to kind of use them, which is a really different thing from hearing them explained or just kind of understanding them. So practice is the focus. And then, like Francis said, we have some time at the end where you can ask questions. We can kind of debrief together and maybe reflect on what was challenging or what came easy to you, or whatever comes up, have a bit of discussion. So that is our plan for today. I think the best way to have you participate is probably to type into your chat box. And Francis has kindly agreed to kind of monitor that chat box and feed questions and comments back to me. But I kind of just wanted to get everybody warmed up and in the habit of losing your inhibitions and feeling free to participate via the chat box. So, and it's also nice to kind of, I think the way it works, I can't see the chat box, but I'm pretty sure you all can see each other's comments. And framing is kind of a collaborative thing. So if you could all just type some hello, some hi to other folks on the webinar into your chat box, and then you'll see each other's comments, and that will be how we do some of the practice activities going forward.
And it looks like we have about 10 hellos and highs in the chat box.
Excellent.
Now. Mm-hmm.
Great, okay. And if there are any snags or if anyone isn't able to participate, you can type those questions into the box too. Is that right? Is that the best way to kind of troubleshoot? And we can switch over to the mic if we need to do that.
Yep.
Okay, so to pick up from where we left off in part one, because we use the word framing all the time here at Frameworks, it's good to just kind of start there and make sure that we all know what we're talking about when we talk about framing. And the main thing to know is just that framing is about how you present what it is that you want to say. It refers to a lot of different choices that communicators make. That doesn't have to do with the content of a message. It's not what you're saying, it's all about how you're saying it. So what things you emphasize, what order you put the different aspects of the message in, how you explain different components of whatever it is you're talking about. Sometimes it's what things you opt not to include in the message. It's the tone that you use, the kind of where you put the emphasis, how you communicate. So I included these little icons here just as a way to remind you that framing it's not like flipping a switch. It's not do this thing and it'll solve your communications problems. It's not a, there's no silver bullet. It's because it's a series of choices, because there are lots of different aspects of framing. It's more like using a sextant, which you see on the right-hand side of your screen. It's kind of gauging along the way and continually reevaluating and reframing, and the idea is to be as intentional and as conscious, as strategic as you can in making those choices. We like to say that everything is framed, but strategic framing is about knowing that you're making choices and making them with intention. So last time you focused on this, the swamp, which is a metaphor we use at Frameworks to describe how when we as communicators craft a message and send that message out into the public, to our audiences, we might like to think that we're sending that out to a blank slate, but our messages always have to contend with all the other messages that are swarming around and all the other things that the public is currently thinking about our issue. So public thinking is like a swamp. It's a diverse ecosystem. There's a whole lot of messy stuff in there. There's stuff that's unhelpful, that's threatening to our message, that wants to eat it. And then there are things that can coexist happily. There are things that can even help our message flourish. So last time you talked about the different cultural models that live in the swamp. So all those different kind of patterns of reasoning, ways of thinking that come to bear specifically when we talk about oral health. And I know April went into several issues that kind of are connected to public health. So things like government and race. I'm going to focus today on 3 specific cultural models because we're talking about framing oral health equity. And these are three ways of thinking, broadly speaking, that are really dominant within the public mind. So these three cultural models have a major role to play in terms of determining how our messages are being received and helping us think about what we want to navigate around. These are unproductive cultural models, what we want to navigate around when we craft messages for the public. There are a few bright spots here too. These are productive ways of thinking. They're less dominant, meaning it's possible for us to think these things, but we need to be prompted to do that. They kind of are recessive in the public mind, and they can be nurtured. They can be kind of fertilized and brought to bear, which is what we as communicators want to do. So these are ideas. I didn't actually mention I didn't name the unproductive cultural models. So we have individualism, which is a way of thinking that puts responsibility on individuals, thinks about outcomes as resulting from individual action. So if we think about, for example, inequities, rather than thinking about the causal mechanisms of inequities or structural inequity, it's kind of easier for the public to think about, well, if an individual has, is disadvantaged in some way, or it has a lesser outcome, as, for example, poor oral health, what did or didn't that individual do to lead to that outcome? That's an individualistic way of thinking, and it's very dominant when we think about oral health issues. Otherism is similar to that in that we think about issues in terms of groups, but what's distinct about it is that we all kind of we as members of the general public, regular people who are not experts in oral health, it's a common pattern of thinking that we sort of identify with a particular group and then use that group identity as a way to kind of opt out of an issue, to think, for example, this is about folks who live in rural areas and I live in a city, so this isn't really about me, or this is about a particular racial group that has different outcomes than my racial identity group. And that kind of, that in-group, out-group dynamic informs the way we understand lots of different aspects of oral health and oral health equity in particular. It's unproductive because it makes us think almost competitively between different groups. It fosters zero-sum thinking, where we might be more inclined to think that a program or policy that helps a group that we don't belong to, that we're not explicitly members of, is somehow hurting us, is in competition with my group's interests. So that's obviously unproductive if we're wanting to build a collective sense that community oral health for all of us is important, and that our investment in oral health is a shared one. And then the third model is fatalism. So it's kind of just like feeling discouraged about the potential to improve the oral health system, to improve oral health outcomes. And it can be easy for members of the public to feel that sense of fatalism, to have trouble envisioning how the situation could be better, how the system could be improved. So we kind of just feel like, well, there's nothing we can do. It's, yes, there are bad outcomes. Yes, there are problems. I guess that's just the way it is, and to kind of feel resigned to that. So we want to combat those ways of thinking. And then what you see in the rectangles here are cultural models that are productive, that we can kind of build on to foster more productive public thinking. So it's the idea that disparities are unfortunate. We all kind of agree that disparities are a bad thing. There's something there that can be built on. The idea that we have some collective responsibility, that exists. It's recessive, but it exists within public thinking, that we have some commitment to each other. And then this idea that what surrounds us shapes us is another kind of recessive but productive and useful way of thinking that is shared among the public. So we kind of get that our circumstances have some bearing on our experiences, on our outcomes. What's missing from the swamp, and that's going to be key today in terms of thinking about how to communicate about equity, these are what you see in dark circles here are cognitive holes. They're things that are not present in public thinking around the issue of oral health equity, and it has to do with thinking at a systems level, thinking about institutions. There's not a lot of understanding or really cognizance of what the oral health system itself is, and likewise what processes are relevant, what are the cause and effect relationships that come to bear that actually have a lot of influence on what the oral health outcomes of different groups end up being. So because we're focused on practice today, what I want you to think about in terms of the swamp is how to use it as a communications tool. So it's not just kind of interesting to know how the public generally is thinking about oral health, or what exists within public thinking that folks kind of come to a particular message about oral health with. But what you want to know is if you understand what those cultural models are, if you know that there are multiple, even sometimes conflicting, possible ways of thinking about oral health that the public already have, and you know that some of those ways of thinking are more productive than other ways, you as a communicator can look at your own communications and you can decide how to queue up those models that are productive, and then how to avoid queuing up the ones that are unproductive. So this leads us to our first recommendation, which is really about identifying opportunities to frame or to reframe a communication. And it all has to do with keeping in mind what's in the swamp, being mindful of what you're up against, what current public thinking is, so that you can identify opportunities to make productive choices about what ends up in your communication. So we're going to do a little practice with that, with identifying cultural models. And I want you to think about those three main ones that I outlined: individualism, otherism, and fatalism. So for an example, I have up on your screen, this is an excerpt from a data brief that was produced by U.S. Human Health Services. But just take a minute to read the excerpt that I've put in that blue bubble, and then I'll tell you what we're going to do with it. Okay, so now I want you to think about what are the words or phrases in that excerpt that you just read that might be queuing up unproductive thinking. So that might be queuing up those ideas that we talked about that have to do with either individualism, otherism, or fatalism. And when you identify words that come to mind, you can type those into the chat box. Words that exist in this excerpt, but that are queuing up one of those three cultural models.
And again, for those of you that called in over the phone, you can press *4 to unmute yourself if you have anything that you want to share. For those of you on Blue Jeans, the chat box is on the right-hand side of your window. So our first words, geographic isolation may limit is fatalism. Another, first parents may not understand, that quote, why is that an assumption that's being made? Another comment stating parents may not understand cues up individualism. And then somebody else just echoed parents may not understand.
Great. Yeah, those are all great ones. So I've underlined the ones that stood out to me, and they they're some of the same ones that that you all typed in.
So AIAN is otherism, and then yeah, when compared, the comparison is otherism.
Yep. Great. You guys are good at this.
Yeah, really good. Some more comments. Isolation equals fatalism. Parents not understanding equals otherism.
Yeah. Yeah, I like that what you're identifying is sometimes those cultural models get clumped together too. So like geographic isolation, it can kind of conjure up fatalism and also otherism at the same time because it makes us feel discouraged about the issue, like we can't relate to it. But also it feels like we're talking about people that are isolated, they're far away, so it's not us. That's othering.
Another comment is tribal population is also otherism.
Definitely. Yep. It sounded like there were several comments about the parents may not understand and why is that assumption being made. It's when we're talking about children's oral health, that individualism bubble gets extended to parents. We aren't likely to blame, 5-year-olds for poor oral health outcomes. But at that age, it's the parents that get blamed as individuals. The parents, there's sort of a dominant way of thinking that parents are responsible for their kids' outcomes, and we're not seeing broader societal influences, and that's definitely reflected in this communication. Okay, excellent. Let's move on. All right, recommendation number 2 has to do with assigning agency at a collective level. What that means is it's really about making explicit in a communication who or what has agency, who or what is able to do things differently. So it's reflecting, it's signaling who's responsible for having gotten us to where we are, but also who's responsible for taking action going forward. That's a pretty significant thing because so much of what we see in communications about disparities in general and about disparities within oral health in particular have to do with outcomes. They have to do with disparate outcomes. But if we talk about disparate outcomes between two different groups, for example, it often results in making a group that suffers poor outcomes almost the poster child for that problem, for that issue. And it means the rest of us, the system, the rest of the system, the rest of society can kind of remain invisible. Assigning agency is a way to use collective language to signal that we all have agency, and along with that, we all have responsibility to be invested in this issue, to take action, to get involved, to learn more. We're a part of it. So beyond identifying who or what is affected by a problem, assigning agency refers to the framing of who or what caused it, as well as who or what is responsible for addressing it. Let's look at an example of how that works. So in this initial framing, we have, and actually I should say that the recommendation to assign agency at a collective level particularly comes into relevance when we're talking about statistics. So data is often reported, disparities data is often reported without that intentional framing of agency. So take a particularly keen eye when you're looking at statistics. Think about this recommendation. Here's the original wording. 52% of new military recruits couldn't be deployed because of oral health problems. So in this case, agency is attributed at the level of individual military recruits. It's not really clear how this is a social issue or how the rest of us come into the picture, how this is something we all need to care about and address. Here's a way that we could reframe that excerpt and do it by assigning agency at a collective level. Our military suffers when oral health problems prevent deployment for 52% of new recruits. So now we're talking about an institution that we all, that we share. It's not about individuals. And there's less of that blame. We're not thinking, well, why didn't those recruits brush or floss or see their dentists? We're seeing this as a social problem that that affects all of us, that has wider implications, not putting the individuals who have the poor outcomes at the center of the issue. So let's try a little exercise with this. I've written a little passage here in bold, and your task is to reframe the following passage to convey that we have a collective responsibility to ensure good oral health. So the original excerpt that you are going to reframe is this. Each year, students miss more than 51 million hours of instruction time due to absences associated with dental disease. The subject of this sentence is students. Students are the ones here who are described as having agency, and they are missing school. But how could this be reframed so that agency is attributed at a collective level? So take a few minutes to think about how you would reframe that sentence.
And as everybody's thinking, if you want to type into the chat box that's on the right-hand side of the BlueJeans window, and for those of you that are on the phone, you can press *4 to unmute yourself if you'd like to share. Okay, so our first comment, the educational system cannot fulfill its job when children miss school due to dental problems.
Great. Yeah, that's an excellent reframing. We get that we have an investment in our education system. So if it's the education system that has agency in the way we're framing this, now it's easier to see why we all need to care about this. Great.
The education system struggles when dental disease accounts for more than 51 million hours of missed instruction time every year.
Yeah, another great one. Excellent.
Lack of access to oral health care causes students to miss 51 million hours of instruction time.
Yep. Lack of access. That's collective. And it's something being done to students as opposed to students missing instruction time. That's actually a significant framing move there. It has different implications in terms of what we're encouraging folks to think about. Great.
Our schools, students, and teachers are harmed when dental disease causes 50 million missed hours of instruction times a year.
Yeah, that's good. So that was widening the lens from students to now we're talking about students, teachers, schools. Great. Yep, that's the idea here is bringing more of us into the picture. Excellent. Maybe just one more.
What we got so far.
Okay, that's all right. We can move on. I'll put mine up there. My suggestion was each year our schools experience absentee rates due to dental disease that add up to more than 51 million years of instruction, or million hours of instruction time, not 51 million years. So great, there are lots of, and this is always the case with reframing. There's no one right way to do it. There are lots of different frames that that have productive effects that can be helpful. And it's also the case that you can always keep improving your frame. Reframing is kind of an ongoing task. So I love that several of you had different suggestions for how to reframe that sentence, and they were all excellent. Okay, recommendation number 3, offer up strong solutions. This is really critical as a kind of a remedy for that fatalism that can be really strong. If the communications of a field are continually focused on problems and challenges, that feeds fatalism. But explaining problems and then offering solutions that are well matched to those problems is a really effective way to combat that fatalism, to help the public see that change is possible, that actions need to be taken, but also that they're worthwhile, that taking them will lead to better results. And remember that frames that work, April introduced you to this, or reminded you of this, that what we're after here, what we want to do through our strategic framing is to productively shift attitudes, enhance knowledge, help build knowledge about how this system works, what actions are important or not, and then build support for those actions. So offering up strong solutions is a way to kind of be clear about what it is you want to achieve through your communication. And it's about telling a complete story. So any complete, well-framed story has a beginning, a middle, and an end. We're going to focus on the end. You want to tell the story in the order that you see it on your screen right now. It's important to start at the beginning and then build explanation into the middle and then finish strong, but you don't have to construct your story in that same order that you tell it. So we're actually going to start at the end of the story with the solutions, because what we want to do is I want to encourage you to think about where you want to go, what it is that you want to build support for. And that answers this question of what can we do? What can we do about it? What is it that we should all be doing together related to oral health equity? When we're thinking about those solutions, those needed actions, the things that we can do, we have what we call a 5 C's test, which is just a way to kind of think about if the solutions that you're providing are as strong as they can be. Strong solutions are critical to illustrating that change is possible, illustrating that actions are important and needed, but also facilitating the public to think about their own solutions, to kind of further the conversation about what's possible and what we need to do together. So I actually just want to focus on the first 3 of these for the moment. And when you're offering up solutions, you want them to be concrete, meaning specific. So not just, we need better policies on access, but what policy, which, who is it affecting? Who is it aimed at? The more specific you can be, the more concrete, the more useful that is to audiences that are having trouble seeing that solutions are needed or that they're possible. You want to make sure that your solutions are collective. So it's not about kind of giving individuals things that they can go home and do on their own. This is a social issue. This is something that requires collaboration and collective action, and you want to offer up solutions that reflect that are collective in nature. And then you want to make sure that your solutions are causal. So that just means make sure you're offering solutions that that address a particular challenge. They're not just good things to do. They are fixes for existing problems. That's important. Okay, so what I'd like you to do, every time you see that little pencil at the top of the screen, that means we're going to do some kind of practice activity. What I would like you to do is think about a specific solution. So a program, a policy, some other measure or initiative that you think would help address oral health inequity, something you want to build support for. We talk about solutions, that doesn't mean something that would solve the problem of oral health inequity, but something that would go some way towards doing that, something that is a needed action and that would do some good on that front. So this is my example, just to get it started. If I'm thinking about what's needed to help address oral health inequity, is better immigration policies, ones that support social stability and community health for all families living in the US. And especially if I'm going to make that as concrete as possible, I might identify as a solution to extend DACA, to extend the Deferred Action for Childhood Arrivals. Now, you all are issue experts, which I am not, so you will have your own probably way more sophisticated, but certainly more specific measures to offer up as solutions. So make sure that they're concrete, collective, and causal, and then type your solution into the chat box. So we'll just kind of collaboratively put together a pool of important needed solutions. We got anything in the chat box yet?
We just got our first, which is licensing dental therapists can unlock a door to care and health that is currently closed for many.
Great. That's from someone who's done some framing already. That was great. For the moment, don't worry about how you frame the solution. Coming up with a strong solution in itself is part of the framing process, and we can talk about how to word it. You can kind of refine how you articulate the solution in a bit. For the moment, see what you can identify in terms of what the collective actions are that are needed.
Here's another one. Increase payments to dentists for fee-for-service Medicaid to increase the access to care.
Great. Yeah, another good one. Excellent.
I think it's also a good time to tell folks, as you're thinking about developing messages and kind of wordsmithing, we do have a bank of technical assistance hours with the Frameworks Institute. So April Callan will be presenting another Take 20 probably next month sometime. We haven't landed on a date, but kind of Ask Me Anything webinar where if you have some messages you start to play around with, maybe that'll be a good holiday uh, pastime. And if you come back with any questions or if you have anything that you've developed or would like help on, we can do that coming up here soon. There's nothing else in the chat box. Do you want to? Oh, actually, a couple more just came in. Extend Medicaid dental coverage to adults to increase access. And also, Medicaid policy that mandates adult dental coverage would improve the health of people who currently lack access to dental care.
Good. Okay. Sounds like that's one that a lot of folks are thinking about.
Yeah. Another is remove the $1,000 annual cap on dental Medicaid to allow families to get the care they need when they need it.
Great. Excellent. Okay, so we're gonna actually refer back to this solution in one of our later practice activities, but you've got a handful there to work with, so you can, if you're struggling to think of a specific one right at the moment, since I put you all on the spot, you can feel free to use one of the ones that was just offered up there. So let's move to recommendation number 4, which is to lead with a shared value. So now we're hopping back to the very start of the story. And a good place to start is by appealing to something that we all care about. This is how I think about shared values. They're cherished, enduring cultural ideals. They're things that we're all committed to. And appealing to a shared value, something we all care about, is a really effective way of orienting public thinking around an issue. It's a way to communicate right from the outset of a piece of communication that what you're about to talk about is something we all should care about, that we're all invested in. It's a way to communicate why this issue matters, why the message that you're about to deliver matters, and what's at stake. So as a frame element, these are some of the things that appealing to a shared value does. It helps establish a collective orientation. So it's moving thinking away from both individualism and also otherism. We're kind of bringing everyone together and reminding the public from the outset that there are things that all of us care about, that we have a shared interest in. So it's establishing a collective orientation in that sense. It's priming a common good mindset. So not only do we all care about this thing, but we all will benefit from getting it right. It is something that we all stand to gain from. It also taps emotions in a way that's kind of unique, or at least especially powerful with this particular frame element. So values tap emotions that are effective for policy thinking, that kind of work for helping folks orient productively towards what we can do together, why we care about something, and how that translates into action. So it prompts feelings like curiosity, concern, and also kind of a sense of can-do, a sense that that there's somewhere to go from here, something we can do about this together. We like to talk about values in terms of helping move us from me to we. So we're not thinking individually or just about ourselves, we're thinking about the community, the population as a whole, and our shared interests. But because values do tap into emotions, because they serve a really effective role at orienting public thinking and orienting understanding around a particular issue, it's important to use them early in a communication so they can serve that orienting purpose, so they can kind of pave the way for what comes after it. You also want to appeal to it frequently throughout the communication. So at the beginning, but then often refer back to it to kind of reinforce that those values, that sense that we have this shared interest. And the other thing is it's important to use the right value, the one that orients thinking in the most productive way. So it's not just about appealing to a value, it's about appealing to the right or the tested shared value. It's why we test frame elements. We actually measure how they affect public thinking, how they influence how messages are received. And what we found is that two values in particular, two shared values, do some really good work in terms of orienting public thinking. So the first one is this idea of targeted justice. The idea is different situations call for different responses, and different groups have different needs. By making sure that our health system allows everyone to access the supports we need to maintain good oral health, we can create a more just and fair society for all. It's an important idea because it helps orient public thinking around the idea that a kind of one-size-fits-all system, a blanket system across the board, is not actually a just system. Different groups have different needs, and if we want our society to be fair and to make sense in terms of accounting for the different needs that we all have, we need to take measures to acknowledge those differences and to address them, to accommodate them. So targeted justice is a shared value that helps prime public thinking and appeal to that thing that we all care about, which is about fairness and equity and justice. The second value is responsible management. So here's the idea behind this one. Using resources wisely means making smart decisions now to avoid waste and complications later. When all communities have strong prevention efforts in place and access to quality oral health care, we reduce costs by stopping problems before they start. So this is a really effective value at talking about prevention, and in particular, helping to encourage thinking about the idea that we are all better off. We're all more responsible and benefit from ensuring that everyone has preventative care. So it tackles kind of all three of those unproductive cultural models in the swamp. So to practice using a value, to think about how you would implement a shared value in your own communication, what I would like you to do is think about one of those solutions, the one you came up with or one that you're on board with, that you agree we want to build public support for, and then decide which of the two shared values here, either targeted justice or responsible management, decide which one is most appropriate to appeal to include at the very beginning of your communication, to productively orient public thinking for receiving a message about that solution. So targeted justice, if what you're wanting to kind of cue up at the very beginning is the fact that different groups have different needs and that we, in order to be a fair society, need to account for those differences? Or is it talking about prevention? Is it about how we all benefit from making sure everyone has access to preventative care and that we have a responsibility to ensure that that happens? So pick one of those shared values and then craft a really short statement. And it doesn't have to be one that specifically refers to the solution that you picked. It should just be one that is aligned with it. And I will give you my sample as inspiration, just to get the ball rolling anyway. So I chose targeted justice, and this is my value statement. We all recognize that a range of health needs exist across our population. Different communities require different supports, so it's only right that our policy decisions take each group's particular circumstances into consideration. I decided not to use the word justice. Part of why I did that is I just wanted to reiterate the fact that this isn't about dropping a specific word into your communication. It's not that there's a silver bullet here. It's the idea behind targeted justice, not those specific words, the idea itself that that does the work of kind of getting public thinking going in the right direction, opening up the public to your message. So take a minute or two to craft just a sentence or two that appeals to the shared value of your choice.
Okay, so we have our first comment. It's addressing prevention now by providing oral health services to children can save money in the long run by ensuring these problems will not get worse and more expensive when they are adults.
Okay. So responsible management was the idea there. Right.
There's a lot coming in now. Dental disease impacts health and productivity. Innovative states have been able to develop solutions to the challenge communities face regarding lack of uh, affordable, a lack of or accessible oral health care. I'm sorry, it's a little jumbled. Fair system would find ways to address those needs. So were
Good.
you able
Okay.
to hear that one? I don't know if I read
Yep.
that well. Okay.
I heard it. Yeah.
Yeah, if you could make sense of.
I wonder if you could just read the last sentence again.
Yeah. Okay. The innovative states have been able to develop solutions to the challenge communities face regarding lack of or accessible oral health care. A fair system would find ways to address those needs.
Yeah, great. So that idea is perfect because the shared value is the thing that that opens that door, that paves the way for the more substantive message, the content-heavy message about the specifics, about the oral health system. If you can put the statement about fairness before the one about the kind of obstacles to access, the way the value works is it actually makes the more specific, the substantive part of the message more influential. It makes it more easily taken up, more, it makes your audience more receptive to that explanation part. So if you can put the message about targeted justice or the appeal to fairness in this case, that seems like the word that cues up the idea behind targeted justice. The sooner you can put that, the more effective the rest of the message will be.
Okay, and we have a few more.
Okay.
Policy focusing on a federal and state mandate for a universal age 1 visit following the AAP, ADA, FDI, and AAPD policy recommendation, framing infant oral health and early childhood caries prevention as an issue of equity and social justice.
Great. I really like the end of that one too. In fact, if there's a way to get the equity and social justice ahead of there are some acronyms in that excerpt. If there's a way to get the equity and justice up front, they can do the work of helping folks think more critically and a little bit deeper about the importance of those specific programs. It's really hard to do that. I'll say that a lot of these recommendations are challenging to put into practice, in part because some of them are counterintuitive. It's a different way of communicating than we're used to. It's hard to appeal to a value before talking about the substance of the issue that you know is the point of the communication. But it's a way to help. It's a kind of a way to help your substance of your message go further, is by putting a more generic, at least broader value statement in front of it. Maybe one more, Francis?
Yeah, we have six more, so I didn't know if you wanted me to just read them out. I'm also capturing the chat box so we can share them back with the
Oh, great.
recording.
Excellent. Okay.
Um, and the next one down is healthy teeth in every mouth means finding out the needs of each individual and have a system responsive to individual needs.
Great. Did you want to just read through them?
Do you want me to? I can do that.
Sure. Yeah, why not?
Adults and kids have different dental needs, but public programs tend to target children over adults. A fair healthcare system would address the needs of the public without regard to age.
I
The
like
next
that.
one is identifying and investing in preventive services for communities that have the highest rates of oral health needs will result in improved outcomes for all communities. A rising tide lifts all ships. Love that.
Nice.
Agree, but infants, geriatrics, and special needs are still very vulnerable populations that need an equity focus. I think that was in comment to something said before. Government policies have disadvantaged many communities for generations, causing long-term harm to our health, to the health of our nation. We can become a stronger, healthier nation by making sure everyone has access to health.
That's another good example of those are two great sentences, and if you just swap them, then the value comes first, and the the part about getting into the problem, the challenges that we need to fix, will have more efficacy. It will be more effective if you've primed it with that value statement.
And the last one that we have, providing coverage for preventive and restorative services for adults through Medicaid can prevent and address oral health problems while they are still manageable and is a wise use of resources. An ounce of prevention is still worth a pound of cure.
Great. Excellent. Thanks to everyone who's participating. Those are great responses, and it's clear that you all have got some framing practice under your belt already. Also, this is just more interesting and more relevant when you're participating, so thanks for that. Okay, let's move on to the last recommendation, which is about harnessing the power of explanation. And this is so important when one of the goals of communication is to help build public understanding, to help increase public knowledge about oral health, about how it works, about the systems that are critical to ensuring quality oral health for all of us. So we're at the middle of the story now. This is where we've established why this matters by appealing to a shared value. We know where we're going. We're going to end with a strong solution, which is a specific collective action that we want to build support for. In the middle of the story is where we build explanation. It's where we help the public understand where there are challenges, how the system should be working, and where it's failing in that, where it's not living up to its potential. And our task really is to provide explanation in a way that links the problem to the solution that we want to build support for. That's critical in terms of explanation, linking problem to solution. So the frame element that we use to do that, to build explanation, is metaphor. Metaphors are really effective explanatory tools, in part because they compare a new idea to a familiar one. It sets up this analogy, and we can build on what's already familiar to the public to help them understand this new idea, the oral health system, which is not particularly familiar. It makes something that's kind of abstract as a concept a little bit more concrete. Secondly, metaphors enable people to see systems. We're not just talking about affected groups or affected individuals. We're understanding that there are institutions and structures at play. This is a whole system that we're talking about, and a metaphor brings that whole system into view. And like I mentioned, metaphor helps us link the problem to the solution. So just like with values, because metaphors do so much work, it's really important to use the right one, to use the one where that analogy is helpful. Because metaphor does so much of the communications work for you, you don't want to hand over the reins to a metaphor that's not tested and that might be doing unhelpful work rather than helpful work. So the metaphor that is tried and true here, the tested metaphor that does do a really effective job of building understanding about the oral health system is the idea of keys to oral health. So the idea here is to get to good oral health, everyone goes through a series of doors, but for some people, some of those doors are locked. Without the keys, people can't get through those doors and can't access the oral health that's needed, that we all need access to. It's an effective metaphor because we all kind of get the idea of how locked doors and keys work. We all know the function of keys. It's a way of setting up a problem. We understand that a lock is a barrier, is a problem, but that there are keys to it, there are solutions. It facilitates a conversation about problems and solutions. So these are essentially the two components of this metaphor. We've got locked doors, the things that deny access to critical oral health supports, and we've got keys. I think what I'll do in the interest of time is I'll walk you through my example, how I've put my example into practice using this metaphor as a way of building explanation around the solution that I want to build support for. And then we can turn to your questions. I want to make sure we have a little bit of time for discussion. And then you can kind of take this home with you to work on establishing your own metaphor using this idea of locked doors and keys. So I mentioned earlier that the solution I wanted to build support for is the idea of extending DACA, because I see immigration policies as playing a critical role in supporting social stability and supporting community health for all families in the US. In order to build an explanation into my communication about why that policy is needed, why this is a solution to a problem, I have to be able to explain the problem. So I have to be able to identify what those locked doors are that this provides a key to. So in my case, these are some examples of barriers to access to good oral health, locked doors that this would provide a key to. And what I'm thinking about is not that new programs need to be introduced, but that there are existing programs that folks are not enrolling in or that are withdrawing from because of our immigration policies. So the barriers include things like the threat of repercussions for immigrants who utilize existing public programs, the heightened risk of exposure and deportation, unstable residency and or employment status, and increasing distrust in existing public healthcare systems. So those are things that make, for example, a family where the parents are dreamers less likely to enroll their children in a school sealant program. And now I've kind of connected problem to solution. We can see how extending DACA would provide some of that stability, would eliminate some of these barriers and therefore enable access, enable folks to enroll in those existing programs. So on your own, think about the solution that you named and then see if you can explicitly identify the barriers to oral health that solution aims to overcome. This is how you build the sort of nuts and bolts, the substance of your communication in a way that builds explanation right into your message. And that's how you develop public understanding of the issue and build knowledge about what actions are needed. And you've got a complete story here. This is my kind of summary slide. I will, maybe instead of reading through it, we'll just take a few questions. And then, like Francis said, these slides will be available so you can review them on your own. I'll leave it up to you so you can read it for now. Do we have any questions, Francis?
There are not right now. Again, for anybody on the phone, go ahead and press *4 to unmute yourself. Otherwise, the chat box in the BlueJeans window, it should be on the right-hand side. I can also share a PDF of the Avoid in Advance. I actually have one hanging in my office since the message memo first came out, so an effective tool.
Perfect.
Still no questions. And we can also include your email address or April's email, and we can include, I think most people should be aware we have a communication support request form. I'll share the link to that. So our communications and messaging work group, they are thinking through a lot of different messages, both for the network and for Oral Health for All. So people that have questions can use that channel as well. And then if that requires technical assistance from Frameworks, we can start to tap into those hours as well. So I will include this with the roundup with the recording, but I think that's it. So thanks so much, Jessica. That was really great. A lot of
Thanks everyone
information.
for joining and participating and having me. Good luck framing, and I'm glad, Francis, you mentioned the TA hours were on hand and happy to continue helping. And I know you're all continuing to work with April, so I'm glad to be able to step in for a little bit.